Hi everyone. So today's topic is massage therapy for the amputee, which probably not one of the immediate things that people think of as benefiting from massage treatment, but actually it really does have its value, and I suppose it's something that I've sort of decided to do a topic on because I've probably spent more time around amputees, than most massage therapists out there. As a nurse, I worked in various surgical settings, including general and orthopedics, where I certainly cared for a few both above and below knee amputations. And usually these amputations were due to either diabetes or some form of infection. Actually, the first surgery I ever saw as a student nurse was a leg amputation. But also I used to attend sports camps for disabled children, 2 or 3 times a year. And there were quite a few children there actually who were amputees, or even those obviously who have been born without limbs. But for the purpose of this discussion, we're talking about specific things that occur with amputees. Now, in terms of rehabilitation for amputees, this can be quite complex, and it's not just a straightforward, simple physical health issue. It involves psychological, emotional, social aspects, that also are really important to someone's recovery. And quite often, I think obviously for the medical teams, quite often the focus, it's very easy to put the focus all just on the physical problem. But obviously that's one thing I hope that I've kind of probably talked about quite a lot, is that the value of massage is that it can actually help, yes, with the physical problem, but it can also help with, the psychological and emotional aspects as well at the same time, which obviously then has a real knock-on effect on someone's social life. And so, but I will explain more as the video goes on. So, it's one of those issues where individualized care is probably more important than ever. And so, the rehabilitation process, it can be limited, whether it's due to, limitations in resources or the types of therapy that may be available in your area, and also in terms of the type of prosthesis that you are able to access, and that can make all the difference, to your walking pattern, for example, moving forward. But, as with so many things, a lot of these things just come down to funding. But, this is where massage therapy can certainly play an important role, because, the therapist has more time to offer than, maybe someone in an NHS setting. And as I say, we're able to offer both physiological and psychological support, which is going to be tailored to you as an individual, rather than a sort of almost like a set program, that follows, protocol. Now, Amputees, quite often, a lot of the issues, they'll feel pain, muscular spasms and tightness, and also stiffness in muscles outside the area of the amputation. And this is because, other muscles end up compensating for the limitations that come with amputation. And in addition to these compensatory sort of areas of muscle tension, we also need to look at biomechanical and postural changes, which also bring their own set of challenges too. So massage therapy can incorporate a combination of myofascial techniques, trigger point therapy, postural alignment, joint mobilization, and also give you some stretching exercises that you can take away with you. And all of this together is really effective at treating, dysfunction and pain. And, if you can get all of this with, while also offering psychological support, helping to reduce anxiety, helping to improve the sleep patterns that are often disturbed because of that or because of the pain. These things impact also on quality of life, in addition to, the physical trauma itself. And, anxiety and sleeping and things, they're also going to really impact, it's not only the initial trauma that will impact on someone's quality of life. It's also, even once the surgery is done, it's, the rehabilitation process is really intensive. And even that can, really have a big impact on, your quality of life and what you're able to do, because it takes a lot of time and energy, to get through that process. So, yeah, massage can certainly be used as a short-term solution, but it's really particularly beneficial when it's incorporated into the rehabilitation process and used alongside prosthetic training, helping to combat muscle strain and combat those postural and biomechanical issues. And it can be used as a maintenance, healthcare treatment in the long term, helping to deal with all these usual, amputation related conditions that arise, which I am going to go on to talk about. So, certainly obstacles in terms of fitting new prosthetics and enabling ambulation. The usual obstacles are things like reduced range of motion, development of contractures due to maybe poor fit of the prosthesis, and also pain due to, just due to the changes in the soft tissues. But these are obstacles that can all be overcome with the help of massage, not only because of the effects on the musculature and the pain levels, but also in terms of maintaining skin integrity, which when you sort of initially get a prosthetic in particular, and certainly if it doesn't maybe, fit particularly well at the start, that can really affect the condition of the skin as well. But as we know, massage can help with that. And, if you're keeping the skin in good condition, it's going to help with range of motion as well, because if your skin starts breaking down and getting really sore, that's going to become painful as well, and then you're going to be restricted in your movement again. So but also by including massage in a pain management program, these factors such as anxiety, circulatory issues, soft tissue dysfunction, all of these things that impact on pain intensity, they're all being treated at the same time, rather than having, loads of different treatments. So actually, it's a really kind of time effective treatment. And so in this way, massage can really help improve a client's quality of life. Now, obviously, every amputee's rehabilitation is going to be different. It's dependent on age, on the reason why you had the amputation in the first place, on general health, and also what stage of rehabilitation you're in, whether you're kind of immediately post-surgical, whether you are at the stage of undergoing prosthetic training, or whether you are, you've gone through all that and you're now in a sort of more general maintenance program. And as a therapist, it's important, that we liaise with, the multidisciplinary team, with physiotherapists, with occupational therapists, with doctors, whoever it is that's involved in your rehabilitation, to ensure that everyone is working together, and that progress can be fully monitored. So if we look at the benefits of massage therapy, obviously we've mentioned some of them already in passing, but we're looking at obviously reducing muscle tightness, stiffness, reducing muscle spasms, and increasing muscle length, all of which will help reduce the pain. We're looking at increased circulation, which also will help reduce swelling, and also maintain skin integrity. We're looking at reducing scar tissue tightness, and also improving sleep patterns and just increasing relaxation by reducing those levels of anxiety and stress. So there are, quite a few benefits there. So if we look at the actual specific rehabilitation goals of massage, we're going to sort of look at a lot of these specific sort of physical symptoms, if you like, that are so common in amputees, particularly in the early stages. So the first one of those that we're going to look at is phantom limb pain. Now, probably 70 to 80% of amputees actually suffer with phantom limb pain. And this is basically, it's a subjective sensation of a burning or stabbing, crushing or throbbing pain in the part of the limb that is no longer physically present, which to a lot of people makes no sense whatsoever, because if the limb's not there, how can it hurt, right? Well, while it generally happens in that immediate post-surgical stage, 40% actually may continue to suffer with phantom limb pain after the first year. And, for some, massage therapy actually is a really important factor in overcoming phantom limb pain, because it is thought to increase the sensory input from peripheral nerves in the amputated limb, which overrides the brain's perception of pain, thus potentially relieving the phantom pain. So if we just look at this diagram as an example, thinking about leg amputation. Now, so for example, coming down the thigh, you've got actually two of the biggest nerves in the body. You've got the sciatic nerve and you've got the femoral nerve, both of which come down into the thigh. So, these are big nerves, and you imagine if suddenly they're cut, it's going to take a little while for the brain to actually kind of catch up, and realise that these nerves actually aren't supplying, this limb anymore. And because it takes a while for the brain to catch up, that's why there's still pain, felt. And certainly one of the, I believe it's always suggested that, amputees kind of use mirror therapy to kind of retrain their brain, that this limb is no longer there. Now, in terms of massage being used for phantom limb pain, there's no set rule. It could be that the massage is direct to the actual amputated stump, or it could be to the muscle and soft tissues above the stump, which is known as the residual limb, or it could be to the soft tissues at the sort of proximal end of the affected limb. So, for example, if it was a thigh, sort of, above knee amputation, it could even, involve massage sort of up, around the pelvis. But yeah, it's certainly, massage has certainly been shown to be really quite effective in helping with phantom limb pain. Now, the next symptom, if you like, that amputees tend to suffer is residual limb pain. So this is pain that is experienced at the distal end, so the stump of the amputated limb. And this can happen for a variety of reasons. It could be that you've got a poor prosthetic fit, and maybe because of that there's also swelling. It could be surgery related tissue damage and swelling. It could be due to scar tissue and adhesions from the surgery. Maybe there's some other kind of joint dysfunction there. Or it could be, even referred pain from sort of other tight muscles that are overcompensating and other trigger points, or, muscle spasms, poor circulation, and also even neuromas, obviously we've seen that there's a lot of nerve involvement going to be, applicable to this sort of client. If we sort of think back to the benefits of massage, we know that it can deal with the muscle spasms and help by reducing pain through relieving that tightness in the muscles. We know that massage can help release scar tissue and work on trigger points. We know that it assists with, circulation and sort of improving oxygen and nutrients, coming into the tissues, which help again with recovery. And we know that it helps, through its effect on circulation with, skin integrity. you know, and sort of all these issues that happen with a poor, you know, prosthetic fit. So the next symptom, if you like, for amputees is desensitization. So quite often what happens is that the amputee will experience a lot of hypersensitivity in the residual limb. And this is actually really very common, particularly around, you know, any areas of scar tissue, or if there are hypertonic muscles, so muscles that are like going into spasm. And what then happens is this can then cause a pain cycle, which again is going to interfere, you know, with functionality. But through manipulation of the soft tissues around the stump, this can actually reduce nerve sensitivity and myofascial pain. And this then can help to break that pain cycle and help to kind of regulate how the nerves are functioning, and you know, consequently it reduces those muscle spasms and reduces the pain. Circulation. Obviously we know massage helps increase circulation. And we know that good blood flow is essential to the recovery process, as we've said, in terms of supplying oxygen and nutrients to the tissues, and also in terms of improving lymphatic flow and enabling, you know, elimination of all those waste products. Now, if there's poor circulation of the residual limb, this can cause cold sensations and also burning pain, which is going to be even more you know, increased when the weather's cold, you know, because in cold weather, you know, our peripheral blood flow is naturally reduced as a way to keep our core temperature, you know, regulated. You know, the body naturally keeps sort of those essential bodily organs warm before, you know, keeping the limbs warm. So so this these cold sensations and this burning pain basically happen due to the nerves and arteries and capillaries, all of which help regulate blood flow, you know, because they've been damaged during the amputation surgery, and because of the inevitable muscle atrophy that occurs due to reduced functional requirements of the muscles. You know, this is why, you know, amputees will get these sort of cold sensations. When muscles atrophy, actually, you know, the muscle pump action, which assists with blood circulation, will no longer function. But massage therapy actually can mimic this pump action, and therefore it kind of passively assists with the fluid movement, whether it's blood or lymphatic fluid. Now, the other way that massage can help with these cold sensations is that, you know, you'll all know if you've been for a massage, you know, because of the localized, sort of because of the friction and the, you know, localized increase in blood supply that happens as a result of that pressure and friction, which is called hyperemia. You know, you'll notice when you've had a massage, the skin surface will often, you know, become red during a massage, and certainly during a sports massage. And so this can also, this is also a way that massage can help to warm a cold residual limb, you know, and in doing so help also to reduce that burning pain. Okay, so another issue is scar tissue. Now, any surgery is going to introduce this tough, thick scar tissue, that kind of causes restrictions on the muscle. And that's on top of any scar tissue that has already occurred, if there was an injury leading up to the amputation. So, for example, if we think about, people who have served in the military and become amputees, maybe due to some sort of traumatic event, there's already, before they've even undergone surgery, there's already going to be scar tissue forming, whether that's, through, that initial injury, or, even through infection that's introduced in the process of that injury happening. Scar tissue will negatively impact on the adjacent tissues in the surrounding area. Not only will it cause pain and reduce range of motion, but it can also cause a lot of itching, which may also then reduce the amount of time that a client can actually tolerate wearing their prosthetic, and working on their recovery. But as we know, massage can release scar tissue, which therefore improves tightness in the muscles and improves that range of motion and improves the pain and the itching. So potentially, it can really increase tolerance levels when it comes to not only wearing the prosthetic, but also in terms of actually doing, those rehabilitation exercises, during the prosthetic training. So the next issue that we're going to talk about is swelling. Now, swelling in amputees may occur either as a direct result of the surgery or due to prolonged prosthetic wearing or a poor prosthetic fit. But this can be improved with manual lymphatic drainage. And basically what that does is it helps to drain excess fluid, which may compress internal structures and can cause tingling, numbness and discomfort, particularly, if it presses on nerves. But also it can help maintain skin integrity again, and just help improve the circulation and prevent the skin breaking down, and also it can assist in by doing these things, and by draining away any excess fluid, it can also help in terms of being able to find a good prosthetic fit, which in turn is obviously going to improve functionality. And then the final issue is with muscle tightness, stiffness and muscle spasms. Compensatory muscle tension, pain, repetitive strain and stiffness in the joints. These things all occur in amputees due to increased function of other muscles to counterbalance the limitations of the amputated limb. And these imbalances, will further impede functional ability, and they really do require early intervention, to avoid additional problems. And some of the problems, that we'll often see in amputees might be things like carpal tunnel syndrome, in upper limb amputees, and this is due to increased use of the arm that is remaining, or persistent lower back pain in lower limb amputees, and this is going to be due to postural changes and altered weight distribution. Muscle spasms in the residual limb due to maybe supporting the weight of a prosthetic, that alone can cause muscle spasms. Contractures in joints above the amputation site is also common, and if this goes untreated, it can actually lead again to poor prosthetic fit, which we know then causes all sorts of other issues. It can also lead to abnormal gait, pain, and potentially the inability to walk at all with a prosthetic if it remains untreated for too long. Headaches actually also are quite common, and this can be for a number of reasons. It can be due to medications, it can be due to reduced sleep, whether that's due to stress and anxiety or due to pain levels. It can be due to dehydration, muscle tightness, if you're compensating altered posture for a lower limb and you're compensating, maybe around the shoulders, and then that tightness goes up into those neck muscles. That's known for causing headaches. But also headaches can be common through referred pain from other trigger points in other areas. So, but all of these imbalances can be treated with massage. But for some amputees, this may, require more regular maintenance treatments. As we've said, treatment really has to be individualised. But, as always, if you're going to go down this route and incorporate massage into your rehabilitation program, you absolutely must see a therapist who is registered and who is experienced in dealing with these issues, which may not be easy to find, but there are some of us out there. But hopefully anyway, this has given you a way of dealing with some of these symptoms that you may be experiencing. Even if you have been an amputee for quite some time, it's never too late. But also if you are actually due to have amputation surgery, maybe you're watching this, and hopefully it will give you some additional hope of being able to manage these things as they come up. But as always, feel free to comment. Do contact me through my Facebook or Instagram with any questions that you might have, and I will do my absolute best to answer you. Feel free to subscribe to my channel because there will be more videos coming up. But yeah, hope this has been of some help. That's really all from me today, so take care and I'll see you next time.